Amputation is the surgical removal of all or part of a limb or extremity such as an arm, leg, foot, hand, toe, or finger. When performing an amputation, the surgeon removes all damaged tissue. After completely removing the dead tissue, the surgeon may decide to close the flaps. This is called a closed amputation. Or the surgeon may decide to leave the site open. This is called open flap amputation. In a closed amputation, the wound will be sutured shut right away. Guillotine amputation, open, circular. Guillotine amputation is an amputation performed without closure of the skin in an urgent setting. Guillotine amputations are performed either for speed or for control of infection before a second, definitive amputation. Transmetacarpal amputation. Secondary closure or scar revision. Reamputation. The physician amputates the fingers. The physician makes circumferential incisions around each digit excluding the thumb. These incisions are carried out at the mid-proximo-phalangeal level. The extensor digitorum communis of each digit, also the extensor indicis proprius of the index and the extensor digiti minimi of the little, are transected at the metacarpal bases. Individually, each metacarpal bone is transected and elevated from its soft tissue bed. The lumbar calories and dorsal interossei are sectioned. Identified blood vessels are ligated. Nerves are ligated and transected. The flexor tendons are transected and allowed to retract in the palm. The volar plate, ligaments, and palmar fascia at this level are all cut and amputated digits are removed. The open periosteal tubes are closed. The soft tissue flaps are drawn over the end of the stump, and interrupted sutures are used. A soft dressing is applied. Amputation, thigh, through femur, any level. Immediate fitting technique including first cast. Open, circular, guillotine. Secondary closure or scar revision. Reamputation. The physician makes incisions so that equal anterior and posterior flaps are fashioned. Dissection is carried down to the femur. Arteries and veins are doubly ligated and transected. The sciatic nerve is divided. A gigli saw is used to section the femur and bevel the cut ends. The anterior and posterior myofascial flaps are sutured together and secured to the lower end of the femur through drill holes. Incisions are closed in layers and a temporary drain is applied. An elastic, plaster cast is applied over the amputation site. A belt suspension apparatus may be incorporated into the cast.